Good evening, ladies and gentlemen. This is Dr. Silva, and I'm here to talk to you about avoidant personality. No, I'm not. I'm here to talk to you about dependent personality disorder, which is in cluster C along with avoidant personality disorder, and it shares a lot of characteristics with avoidant personality disorder, as well as obsessive compulsive personality disorder. And I've already done videos on those two conditions, and so I encourage you to check them out. The DSM, the Diagnostic and Statistical Manual of Mental Disorders, and I'm basing this talk on the most current edition, 5th edition, text revision, adopts a categorical approach to classifying these conditions. And so they treat these personality disorders as though they were qualitatively distinct entities. But there is another model, a dimensional model, that I myself favor, which considers these conditions and personality traits in general to be on a spectrum. A model that is favored more so nowadays is the idea that, especially in psychiatry and mental health, everything's a syndrome, and so the way that we classify things is somewhat arbitrary, somewhat artificial when we designate this little box and we say, well, this is what this is, and we call it this. But a lot of times patients don't fit neatly into diagnostic boxes, and so it's better to consider a diagnosis as a paradigm that you're working under. And I do a whole video on that. I encourage you to check it out. It's When Diagnosis Doesn't Matter in Psychiatry. So please check that one out as well. But today I'm going to talk to you about dependent personality disorder, and this is going to be fairly quick. I'm just going to give you the diagnostic criteria. This is actually probably the rarest of the personality disorders, with a prevalence of maybe less than 0.6%, depending on the sample that you're looking at. But it does occur, and again, it overlaps with avoidant personality disorder, especially, and other personality disorders as well. So it may be somewhat artificial to say that it's a separate entity all unto itself, although there are individuals who only meet criteria for this disorder. They don't have the other associated disorders. So this is a useful diagnostic category. And I've known someone with dependent personality disorder that was enmeshed in a relationship with her mother, who was very controlling, and so that really just the two personality disorders sort of fed off of each other. But so criterion A, which is criterion that must be met by all individuals suffering from this disorder, states that the core psychopathology is a pervasive and excessive need to be taken care of that leads to submissive and clinging behavior and fears of separation. So an excessive need to be taken care of and fears of separation. Those are the two qualities that define this illness. And like all personality disorders, symptoms must be evident by early adulthood at the latest, and they must be present in a variety of contexts. So it doesn't just happen at home, it's not just at work, it's not just in the context of this or that relationship or situation. But what you see are dependent and submissive behaviors that are designed to elicit caregiving. And they arise from this self-perception of being unable to function adequately without the help of others. So individuals that are afflicted with this condition are truly convinced that they can't do things for themselves, they can't be alone. And so it's not just histrionics. These people are not just seeking attention, they're not just doing it to manipulate another person. They might do things that are manipulative, but it's really out of a sense of desperation because they have a phobia. It's really a heightened fear. One of the criteria that I'm going to talk about is an actual phobia of being alone or of being abandoned. So, this overlaps with borderline personality disorder in the sense that they both have a fear of abandonment, but the difference is that these individuals truly question their abilities and their capacity to function on their own. This personality disorder shares most characteristics with avoidant personality disorder. It's most closely related to that disorder. So in order to make a diagnosis officially, according to the DSM, you have to meet 5 out of the following 8 criteria. And I just want to quickly say, as I always do, that in real life, in the clinical setting, I'm not going to not diagnose this if a patient only meets 4 out of 8 criteria. If in my best clinical judgment, In looking at the patient overall, the presentation, their functioning, and their psychopathology, I feel that they do in fact suffer from dependent personality disorder. All right, but for research purposes, they need to meet 5 out of the following 8 criteria. Number 1, has difficulty making everyday decisions without an excessive amount of advice and reassurance from others. This can include everything from what to wear to whether or not to carry an umbrella. These patients are passive, and they allow other people, often a single other person, to take the initiative and to assume responsibility for most major areas of their lives. In fact, criterion number 2, these individuals need others to assume responsibility for most major areas of his or her life, or at least they feel that they do. And it's typically a parent or a spouse to decide where they should live, what kind of job they should have, whom to befriend. Adolescents may allow their parents to choose what they wear, with whom they associate, how to spend their free time, what hobbies to pursue, what college to attend. And this goes beyond age-appropriate and situation-appropriate requests for assistance. For example, the specific needs of children, or the elderly, or disabled persons. You can see dependent personality disorder. It can occur in a disabled person or a person who's gravely ill, but these behaviors go beyond what would normally be associated with that condition or disability. So the example that's given in the DSM is if an elderly gentleman with terminal cancer moves in with his son so their son can take care of him, that's not pathological. That's not excessive or unrealistic. Number 3, because they fear losing support or approval, individuals with dependent personality disorder have difficulty expressing disagreement with others. They feel so unable to function alone that they'll agree with things that they feel are wrong, rather than risk losing the help of those to whom they look for guidance. They don't get appropriately angry at others whose support and nurturance they need for fear of alienating them. The DSM also makes it clear that we should not include behavior that's driven by realistic fears of retribution. For example, at the hands of an abusive spouse. That sort of limiting behavior, not wanting to upset the person who's physically or sexually abusing you because you're afraid of being further abused, that's not evidence that you are a dependent personality. A lot of individuals, perhaps most individuals in that setting, would behave in a similar fashion, at least in the short term. Number 4, has difficulty initiating projects or doing things on his or her own because of a lack of self-confidence in one's judgment or abilities rather than a lack of motivation or energy, okay? These individuals are not depressed. They lack self-confidence, and they truly believe that they need help to begin and to carry through tasks. These individuals will wait for others to start things because they truly believe that, as a rule, others can do things better. They're convinced that they're incapable of functioning independently, and they present themselves as inept and requiring constant assistance. Again, not just to get attention, not histrionically. These are symptoms, behaviors that are driven by anxiety. Interestingly, though, these individuals are likely to function adequately with the mere reassurance that someone is supervising and approving, which makes sense, sort of a placebo effect. Even more interestingly, there may be a fear of becoming or appearing to be more competent out of a fear of being abandoned. And so these individuals might self-sabotage to avoid the idea that they don't need help because they themselves are convinced that they do. Because they rely on others to handle their problems, they often don't learn the skills of independent living, thus perpetuating dependency. Number 5, goes to excessive lengths to obtain nurturance and support from others to the point of volunteering to do things that are unpleasant. In fact, these individuals are willing to submit to what others want, even if their demands are unreasonable. And they may make extraordinary self-sacrifices or even tolerate verbal, physical, or sexual abuse. The DSM states that only when it can be clearly established that other options are available to the individual should we consider this criterion met. It's hard to imagine a situation in which a person submits to physical or sexual abuse because there's no other option available. A lot of times I think individuals do feel that way, and probably the most common reason that they cite is this fear of retribution. And again, you have that don't include situations in which the individual fears retribution from an abusive partner or the person that they're dependent upon. Really, it's a judgment call. The clinician needs to sit down with the individual, really look at all the variables and decide if this is a sign of a dependent personality or dependent tendencies or traits, or if it's just a very difficult situation in which the person can't extricate themselves without some sort of professional and perhaps legal protection. Number 6, feels uncomfortable or helpless when alone because of exaggerated fears of being unable to care for himself or herself. They don't like being alone. There's a certain degree of separation anxiety. In fact, separation anxiety as a child may be a predisposing factor, a risk factor. The individual who may be predisposed to this condition because of genetic factors will also demonstrate separation anxiety as a child. These individuals will quote-unquote tag along just to avoid being alone, even if they're not interested or involved in what's going on. Number 7, urgently seeks another relationship as a source of care and support when a close relationship ends. For example, a breakup or a death. And they don't just seek another relationship, they urgently seek another relationship. These individuals are prone to quickly and indiscriminately enter into another relationship, to attach themselves to another individual, and obviously this places them at an increased risk of being exploited. Number 8 is unrealistically preoccupied with fears of being left to take care of himself or herself. These individuals will worry about abandonment even when there are no grounds to justify such fears. Again, it can be a phobia. It's called autophobia or monophobia. And actually, there are a couple of other terms for it, isolophobia and aromophobia. And it's the morbid fear or dread of being alone, isolated, abandoned, or ignored. The fear has to be excessive and unrealistic in order to rise to the level of a phobia and in order to satisfy this criterion. Associated features, these individuals are full of pessimism, they're plagued with self-doubt, they tend to belittle their abilities and their assets. I view this as a defense mechanism, sort of beating other people to the punch. They tend to constantly refer to themselves as quote-unquote stupid. And again, I think if they're always saying, oh, I'm so stupid to other people, it's their way of apologizing for it, a way of beating other people to the punch, of saying, I know that I'm incompetent. That way other people don't have what they consider to be unrealistic expectations of them. But when they do receive actual criticism or disapproval, they just take that as evidence of their own worthlessness, and they quickly lose faith in themselves, and it really is just a syndrome of quasi-delusional belief in their own inadequacy, very much like the avoidant personality. And in fact, there is a significant comorbidity with that condition. Individuals who meet criteria for this disorder often also meet criteria for avoidant personality disorder. Persons with dependent personality disorder may actually seek the overprotection and dominance from another person. So they may actually really gravitate toward people who are controlling and who won't let them make decisions. They don't want to make decisions, even if it's what they should wear. They avoid positions of responsibility at work, and they cringe at the thought of making decisions out of this morbid fear of making the wrong decision, which they feel fairly convinced they're apt to do. There's an increased risk of depressive disorders, anxiety disorders, and adjustment disorders with depression and/or anxiety, comorbidity with other cluster C personality disorders, and separation anxiety and chronic physical illness in childhood are risk factors. If a child is fragile, physically ill, and is taken care of for a long time by a parent, then they may come to rely on that level of care and continue to need it on into adulthood. Great care should be taken diagnosing this condition, if at all, in young children or adolescents for whom dependent behavior may be developmentally appropriate. This condition is rare. It's diagnosed more frequently in women, at least in clinical settings. And as always, cultural issues need to be looked at and taken into account. Really, the entire context needs to be looked at. But it's an interesting syndrome. And I think standing alone, it may be very rare, but if you look at other personality disorders and anxiety disorders, you're going to see traits, you're going to see some of these criteria. Thank you. Please check out my personality disorders playlist.